Now, as Minia said, that's my name, and I'm the training coordinator of MEPI in Kenya. So like we have the MEPI in Uganda, our MEPI in Kenya is baptized Prime K, Partnership for Innovative Medical Education in Kenya. I've not written there because I want to use MEPI as a, because we are talking about the same MEPI grant. I've seen the Uganda one, they have already established so many sites, and that's what we have been doing in our case. We have been establishing decentralized training sites for medical education. And this is because our university, our teaching college, our medical training school, which is the largest and the oldest in Kenya, has seen an increase of the number of students, medical students enrolled. Of course, out of the demand from the growing population in Kenya for more doctors. So with the increase in numbers enrolled, we have seen congestion in clinical training. So many students are going for those ward rounds, and we have layers of students around during bedside teaching and other clinical skills. Again, these numbers, apart from congestion, we have seen students cannot practice enough, cannot get enough skills during their training. So within the past decade, we have seen an increase in the number of students enrolled. And still, although we have seen this number triple, we have not seen, we are still not producing enough doctors. So we have two problems. We have shortage of health personnel in the country. At the same time, we have a problem of congestion in this old institution where facilities have not been tripled as the numbers have increased. So, in order to enhance this clinical experience, which we are seeing is lacking, our MEPI program decided to start training our students in non-tertiary hospitals. All the training of health personnel by the University of Nairobi takes place in Nairobi. It has been, for the last, since 1967, the training has been taking place at Kenyatta National Hospital. So for the first time, we decided to decentralize this training and experiment on the use of non-tertiary hospitals around the country, and to utilize the consultant preceptors there, the consultants, the senior health personnel there to train our students. So we started on a pilot decentralized training rotation, and that's what has been going on. So this pilot decentralization, how we started it is we consulted with the Ministry of Health. And with the Ministry of Health, we identified sites around the country, hospitals around the country that could be used for training our students. And the selection criteria was based on, of course, the demographies. It was based on the geographic location of these sites and the populations there. From the map that you'll see later, we see that the hospitals are considered where the population is highest, because there are parts of the country that are arid and don't have high populations. Then these hospitals, another criteria was that these hospitals must have been internship centers. Because internship centers is where our students, once they graduate, they are sent to go and practice. And that means those sites already had preceptors who are taking care of interns. So what we did is, after identifying the sites with the Ministry of Health, we went around for initial site visits. We had a multidisciplinary group from Susan has mentioned that we have 5 schools. So we took representatives from those schools, took them for initial site visits, and we also did a baseline survey to establish the capacity of those facilities. Then we called those preceptors from those sites and gave them a training on teaching methodology and mentorship in preparation for them handling our students. So these are the sites around the country. We have done it in 3 phases. The first phase we got 9 hospitals. Then we have another set, we had another 5. Then we have the last one. In fact, we have now done 17. The 18th one we are yet to go to that site. but we are targeting 18 sites around the country. And they are almost distributed according to those dots. Although those dots are 9, most of the population in Kenya is below most of it is just slightly below the equator. Now, after we established the sites, trained the preceptors, we now send students from 4 schools. The School of Public Health was not well presented because it's just a service school in the college. So we have already sent over 300 students from the College of Health Sciences, from the 4 schools that have the full-time students: School of Medicine, Dental Sciences, Nursing Sciences, and Pharmacy. And they have already done clinical rotations in these sites. So this is the distribution. Of course, majority of the students in our college are the medical students, the MBCHB students. Then we have the BDS, the dental surgery, pharmacy, and nursing sciences. Now, these rotations are normally, because these are pilot, and this rotation was not part of the old curriculum. So what we did is we utilized the time when these students were out on electives. So this 6 to 8 weeks for medical students was during electives. Getting the dental students to move out of their school to go to the sites was a bit difficult. So we squeezed 2 weeks out of their program. In fact, divided the class into 2 so that they're able to go and still serve their dental school, which has a clinical is operational. Then the pharmacy students were able to take a whole class, which went on a re-rotation, and the School of Nursing Sciences were able to take at least 2/3 of the class for a re-rotation. So in total, we have done 379 students, and as I'm talking, we have others who are in the field. So the number will go to almost 500. So what was, after piloting on that decentralization, what did we find out? We found out that the students were, first of all, very excited. Like what Professor Sankabo said, this is the first time some of the students were going out of Nairobi. That 10-kilometer, is it going a syndrome? Eh? So, in fact, we had a very interesting case of a student, because the School of Medical Sciences is on Ngong Road in Nairobi. We had a student who had never left Ngong Road since she was born. Because she went to a primary school along Ngong Road, went to a high school along Ngong Road, and went to the medical school along Ngong Road. So it was the first time that we took her out, and she went to a site in Kisii, Level 5 hospital. And the experience has been quite phenomenal for the students. Eh? And they confessed about so much they learned that they could not have learned at Kenyatta National Hospital. Then we also realized that the healthcare workers we trained as preceptors could handle our students very well, and they were very good. They were very good teachers, and they were very good mentors to our students. So it is possible to utilize those workers as trainers. Huh? Then it is also possible, we found out, to use those health facilities apart from using Kenyatta National, which is a referral hospital in Kenya. We can use other hospitals for teaching. We even found out that some of those hospitals are very good centers of excellence in some practices. Like one of the hospitals that looked like it was very rural and very far, we found a center of excellence for a newborn unit, which was a center of excellence. It was the best in the country. So there are some areas that students could benefit from those rural sites. So I was just telling us a short story of our experience, but it is it has been a major change in our college. The students are very happy with the kind of practice they are getting out there, which they could not have gotten at KNH, with the congestion that we're having at our hospital. So this is one of in Kisii Level 5, the dental rotation that took place in when we were trying to pilot on this. So this grant, just like the MEPI Uganda, is from the NIH grants, and we are a partnership of 3 universities. We are partnering with two universities from the United States. That's University of Washington, University of Maryland, Baltimore. And as I said, it was a big multidisciplinary group behind the piloting and establishing the sites. It's a big group. I'm just a presenter from the group. And thank you very much for listening to me.